Shifting vaccine eligibility. Eligibility started with occupations like healthcare workers and first responders.
But now, months into distribution, Rhode Island has shifted to age groups while also adding in qualifying medical conditions.
The line can be thin for exactly who can get the vaccine, and it's a question many viewers have sent into 12 Responds. With new developments at today's briefing, 12 News reporter Brittany Schaefer has a breakdown of everything you need to know.
Today, the Rhode Island Department of Health announced people ages 60 and older and those 16 and older with certain health conditions are now eligible to receive the vaccine. But one woman we spoke to says she's confused why her condition isn't on the list.
Decreased lung function and difficulty breathing.
It's what experts say are COVID-19 symptoms, but something Ashley Lassiter has lived with for decades.
I was diagnosed with asthma as a child.
The medical condition has left Lassiter feeling more safe at home during this pandemic, a place she didn't leave for 6 months.
It's been absolutely terrifying. It's changed the whole life for my family.
Lassiter tells me a common cold can send her to the hospital. It's why she says the state's first day of vaccine distribution was one of the best days of her life. But now 3 months later, Lassiter is questioning when she will be eligible.
It's been very confusing. Looking at the list, it says lung issues, but only specific issues, certain conditions. It's not listed, but you do have some of the symptoms of some of the other conditions that are.
Today, the Department of Health announcing they're expanding eligibility to Rhode Islanders 60 and older and those with certain health conditions. These health conditions include type 1 and 2 diabetes, lung disease such as COPD, emphysema and cystic fibrosis, heart disease, and kidney disease.
People aged 16 to 64 are also eligible if they have a weakened immune system. That includes people who have cancer, people who get chemotherapy or radiation, people who have HIV or AIDS, people who have sickle cell disease, people who take medicine that weakens the immune system, and people who are pregnant.
According to the health department, this includes people with significantly decreased lung function, including asthma cases. But Lassiter tells me it's difficult to tell if she qualifies.
I am not 100% sure yet. I actually called my primary care doctor and I'm waiting to hear back with everything she knows about the condition of my lungs at this point. If I would be okay to sign up. It's hard after so long to be patient.
And that's exactly what Dr. Nicole Alexander Scott is advising residents to do, to try and be patient. She says not every Rhode Islander who is now eligible to receive the vaccine will be able to make an appointment on day one. She says supply is limited, but that should be increasing in the next week or two. I'm Brittany Schaefer, 12 News.
Governor